know the importance of it, but we're always challenged by the busyness of life. So as I was saying before, I really don't worry about the room being packed to the rafters, although I would like that at some point. But I always know that whoever is here today is meant to be here today. And that you're not just here for you, you're here for all of those circles in your life that you influence. So actually, I could probably multiply each of you by how many? 50. Who's got daughters? Who's got granddaughters? Who's got a we got a great one now, right? A great grandmama. Yes, it's true. So with the generations comes going back to telling our stories. It was a long time. You know, I'm a little church challenged too. I was one of those late coming to church folks. Had to slide off a bar stool and get there another story. So with that, when I first went, I didn't really understand what testimony service was about. And finally it clicked in. You know, it's just a little slow sometimes. Your faith grows by hearing stories. So when you hear people's stories that they've been through it, I can get through it too. So thus came the concept of our lives, our stories. The second part of our theme is taking charge of me. Everybody say, taking charge of me.
Taking charge of me.
Because in the grand scheme of things, there's nobody you can change, but there's nobody you can really run. And I'm a CEO. Self-appointed, I promoted myself the first week. I saw my potential and just moved up the ladder. That title that made me get up every morning and put in those 16-hour days and do what I needed to do to be a social entrepreneur, to actually have a business that not only has blessed my family, and I'm happy to say almost every member of our family has done something. Our 6-year-old granddaughter did your candy bags. So everybody's involved, but also because you're my family too. Right? Right. All right. So that's why we're here, and I'm so glad again to welcome you. I'm also tech challenged too, and I did something with my remote. See, I got happy. I started giving stuff away. Okay. So we have to take a pause for the cause and acknowledge our sponsors. So happy that we have a chief of the Illinois Department of Public Health that realizes Southern Illinois does not stop at Springfield. There you go. It actually goes past I-80, right? And she never forgets Southern Illinois. And the Illinois Department of Public Health, my sister back there, Trish, is part of that system. It's really challenged in a lot of respects because it's about really trying to take things to the community. And so we work in partnership with the health departments to do community-based programming, working hand in hand because we can reach outside those walls and do some things that maybe sometimes bureaucratic systems can't do. We can do some unconventional things. So we work closely with them. And so in absence, thank you, Doris Turner, who has provided funding for this conference through the Healthy We Initiative and also for the Wellness Fund. So let's give Doris some love in her absence. With that, we also have another sponsor this year. We have a federal partner, the Region 5 Office of the U.S. Department of Health and Human Services, because as most of you know, we've been doing a lot of work in HIV prevention. Do I have any sojourners in the house today? I should have at least 2. Could my sojourners stand, please? If you've gone through the sojourner training, I want to acknowledge you. I have something for you too. You're our next set of scholarship winners to the conference. I want to thank you. Oh yeah, they stood up then, right? And what it means to be a sojourner is these ladies brought someone in their life that they loved. It's an intergenerational program. So they brought a granddaughter, a daughter, a niece, someone. You can sit, love. And we've been doing that project in Southern Illinois as well as Southeast Missouri. In the Boot Heel, my home away from home. Yay! Hey, Todd Kennett, Caruthersville, Charleston. So they came to the class, 18 hours of pretty intense but fun training. And then they're charged to go out and tell somebody. You know, what we used to say, run, tell that. So go tell. Silence is what's killing us with HIV. It's not going away. I would love to say I'm on my way tomorrow morning to the CDC National HIV Prevention Conference. And they got the nerve, we're having a reception, 30 years of HIV infection. What is that really about? 30 years. So in this field, we're challenged. Everybody knows, you talk to young people, they all know about Wrap It Up, right? But it's so much more. It's about our behavior, it's why we're doing what we do, so that message has to continue. And as a health educator, you know, Miss Lynne waltzes in, teaches a class, and waltzes out. And they're wonderful, they listen to me, and they nod, and they smile. But the bottom line is, if it comes from grandma, or auntie, or even better, mother, those are the messages they're gonna listen to. And those messages can be, you know what, it's not cool to do this. Why don't you wait until the right one comes along? Why don't you live sane if you can't live saved, to quote Pastor Barnett. So that's what the Sojourner Project is about, and Region 5 has sponsored Marvinetta Penn, who you will meet later, who is a wonderful, wonderful performer. So why are we here today? I'm so glad you asked, and this will be the quick part. Part of our mission with the Healthy We initiative is to build a healthier community. What they say is about obesity prevention, but frankly, I'm not as concerned about obesity prevention. I'm more concerned about health and wellness. Yesterday, I went to, one of my colleagues had a wonderful conference in Sikeston, and the lady, although she was about this big, talked to us a lot about that, but she said it's not about dress size, it's not about any of that, it's about your total well-being. So that's what we need to do. We know that there's tremendous disparities in our community. Who knows some of the statistics? Who's getting infected with HIV more than anybody else? This is the face. This is the face. Who dies more? Even though our sisters in the Caucasian community get breast cancer more, but when we get it, what happens? We're sicker, we're diagnosed late, we don't have access to care, so we what? Die more. Who leads the pack in cardiovascular disease, stroke? I didn't have to bring a lot of slides about that, right? So we know that we as a community have some things that we got a lot of work to do. And when I was younger, I'm still kind of young, but when I was younger, 30 years ago when I became a social worker, I decided I wanted to save the world. Well, it didn't happen yet, but I can sure enough try to do something in this little corner with your help. And that, the more amens I get, the quicker I sit down.
Amen.
All right. I thought my preachers were like that. Got my preachers in the house. Thought y'all were. All right. So the other thing that we really need to talk about is cultural and linguistic competence. And let me just share, you know, when everybody sees the word culture, our knees start knocking because we're talking about black and white. It's not about that. I don't care if you're green. If you take the time to not do my exam in 5.2 minutes, because that's all Medicare will pay for, if you can speak to me about my medications, about how I should take care of myself in a way that I understand, and if you are sensitive to the needs of who I am, that's cultural competency.
Yes. Yes.
Participants will also learn more about healthy eating habits and how important it is to be physically active. Did y'all see hip hop abs going on over there? All right, it's just really about movement. My Healthy We, my BFF Ann Terry has been talking to you about the initiative. So I hope everybody will take the opportunity to enroll. It's basic, first of all, it's free. Everybody say it's free.
It's free.
And we provide services, individualized services. The health screenings in themselves are worth hundreds of dollars, but also services that wherever you are, we just want to help you do better. So life skills and those type of things we talk about. So, and also, I think I clicked the slide. Anyway, you're all leaders. I've already talked about that and your role. I talked to you already about health screenings, and I had a wonderful conversation with a beautiful lady. I don't see her. Who did I have the conversation with health screenings about? And this is her first time at the conference. She's not, there she is, hi. I don't want to put you on the spot, but hello. And we talked about the importance of health screenings. And basically, you know, I grew up, I'll talk about me. We grew up thinking what? When do you go to the doctor? When you're sick. So we want to start a revolution. Go to the doctor to stay well. Be aware of every time I see a blood pressure cuff, I'm trying to put it on my arm. Because I need to know. I need to know my numbers. I need to know what my blood sugar is doing. I need to know what's happening with my cholesterol. I don't want to find out laying in an ambulance on the ER table what's going on with me. So finally, it's about personal responsibility. So we're inviting you today. Our ultimate goal is to take charge of you, take charge of your health, be with us because the planet needs you. Each and every one of you is a gift to this universe. And we need you. We need you healthy, and we need you whole. Last little piece about the healthy community that we're trying to build. First of all, if you enroll in the Healthy Week Project, we have a little basket over there, and we're going to do a drawing at the end of this for the Zumba package. So last chance to enroll. Miss Ann, do we have some cards in the basket?
We do have some, and I want to make sure that the cards from the WOW van are bought on also, because somebody mentioned it that I signed up out there, so we need the card from the WOW, so everybody will be able to win.
Well, we'll do that at lunchtime then. Thank you, ma'am. Thank you. The next pieces we've already talked about is the screenings. We'll help you track and set a baseline of where you are with your BMI, your cholesterol, your glucose. We also do a neat little assessment online called Life Simple 7, and we also provide some nutrition education. Then we help you develop your own personal success plan. We have coaching. Dr. Sheena Gibson, I'm so proud that she's joining our team, and if you've got some concerns, you'll actually have a doctor calling you. She just finished her 3rd year, so we can officially call her doctor. And the best news is she is locally grown from Mounds, Illinois, and wants to come back here to practice medicine. So you know she's definitely stuck with me for life. So she'll be calling and offering some advice and some consultation, not necessarily medical advice because she's not quite licensed yet, but she can certainly walk you through and maybe answer some questions and help you with researching and whatever. Do I have any church folks in the house? Anybody eat on Sunday after church or whatever? So we're going to be coming out to the churches, and don't worry, we're not going to take the fried chicken away, but we are going to talk to you about maybe baking it. We're not going to take the collard greens away, but we're going to talk to you about putting smoked turkey in it instead of all of that other fattening stuff. So we're going to come out and work with you where you are and teach you how you can enjoy wonderful meals, wonderful fellowship, but in a way that's healthier. We're going to talk to you about lowering your sodium. If you're hypertensive, if you can get rid of 1 teaspoon of salt in your diet, you can get off of those pills. Right, Mr. Rogan?
Amen.
Amen. All right. So just little things about decreasing that salt. And we're not just going to tell you, we're going to roll up our sleeves and come out and help you do it. All right? That'll be Miss Stephanie working with you on that. Or Reverend Fisher, I guess I should call her too. But anyway, she's going to be helping with you on that. We also are finding out that as we talk to you about eating more fresh fruits and vegetables, it's very hard to get them in Alexander and Pulaski County. We do have a farmer's market in Pulaski. They're open on Saturdays, I believe, but I don't know, a lot of times my Saturdays are busy. I drive over to Paducah to the farmer's market when I can, but it's difficult. So we need to work on a systemic change and figure out how do we increase access. So we're going to put together a resource directory of local farmers. If you sell any kind of fruits and vegetables, we're going to take you back, hopefully with a partnership with the Cooperative Extension Service. We're going to learn to can again. And quite as it's kept with this economy, you might need to learn that anyway. So we're going to talk about how you can realistically have fresh fruits and vegetables in your diet. We're going to work with the grocery stores, talk to them about how do we make it more affordable. So we got a lot of work to do. And we'll be doing fun, informative workshops. And finally, say finally, how many of you know it's tough to exercise, it's tough to eat right, it's all of that. But if you have a support system, right? So as you enroll in Healthy we want you to do it as a team. Your team can be 2 people, an intergenerational team is our preference, but just have a partner so when you want to walk, you want to do hip-hop abs together, you want to do Zumba together, whatever, that you have a support system where you can hold each other accountable and support each other. So you'll have a team. And then finally, after 8 weeks, everybody say 8 weeks?
8 weeks.
We'll reassess you and see how you did. Hopefully, all of those numbers in the beginning are going to be better and you're a success. But guess what? You're a success just enrolling. Because whatever you're learning from it, even if you didn't get where you need to be in 8 weeks, after this build-up program waltzes out your life, you still have it. You'll have tools, tips, resources, and support forever and ever. Amen.
Amen. All right.
I want to acknowledge next our Minority Advisory Committee. If you're on that committee, can you, if you don't want to stand, just wave your hand. I know I have at least one, Miss Willie. Dean's invited. You haven't made it to a meeting yet, but you're still on the list. Do I have any more of my Minority Health Advisory members here? Okay. Well, I do want to acknowledge you. And let me see Ms. Dean. And then Miss Willie will have a scholarship for you as well. They're going to be trained and working through, has anybody ever heard of a documentary called Unnatural Causes? You have? Well, basically, it is a really eye-opening piece that talks about what are the other factors around poor health outcomes. So what we're going to do is, it's a 4-hour documentary. We're going to watch it as a group, discuss it, and then we're going to develop some action plans. Everybody say action.
Action.
And how we can start to address some of those things in our local community. Couple of little nuggets and then I'm going to get out of your way. I had an opportunity to go to a conference dealing with this whole issue of obesity prevention and being healthier. And they had a wonderful speaker there, Dr. James Painter. And for my friends in academia, I would invite you to look up his articles and his research. But I just wanted to bring just a little bit. This is a documentary he produced. His response to Super Size Me, right? Y'all heard of Super Size Me? Okay. This is his response. And these were just a couple of things about food psychology that really stood out in my mind. Some for you to think about, something very easy you can walk out today. Smaller package size. Use smaller plates at home. Because if you use the big plates, we're going to fill them up and we're going to eat everything on them. Put some space between the things in your plate. That helps you automatically deal with portion control. Out of sight, out of mind. Now, I have to confess, I have 2 addictions. One is conferences, and the second one is potato chips. I got to get, you feel me? And I'm so good, I'm a connoisseur. I don't want to just eat any old potato chips. I have to have specifically kettle cooked plain, right? There you go, all right? And every once in a while, I'm going to have some potato chips. I've tried to kick it cold turkey, but I'm doing things that makes it a little harder to get to. Like only on Sunday, buy a small bag, hide it from myself. You know, I got to start psyching myself out. So whatever works for you, and we all have our stuff. It may be ice cream, it may be chocolate cake, it may be fried chicken, it may be whatever it is. But figure out how not to just deprive yourself, because we don't like to be deprived, do we? That 6-year-old comes out and rebels, right? But figure out a way to just be smarter, and that was really a good piece for me. Food labels influence your consumption, and you know they've studied and done all kind of stuff. There's certain colors that attract us and all of that, so we got to be smarter than those marketing people, and we are, right? So I would just invite you to check that out. Then yesterday, and again, I have to give credit to my friends at the Missouri Boot Heel Regional Consortium, Ms. Paula. Heard a wonderful speaker, and she gave us these tips. And I've actually already signed up this lady to come to next year's conference, which, by the way, is the same time next year, so y'all can put it on your calendar now. And she's going to be with us, but she just gave us a few little nuggets. Leave soda alone. She called it, you know, I'm beginning to call it, it's the devil's brew. Even diet soda, there's really nothing good about it. Don't eat within 3 hours of going to bed. Take a daily vitamin. Don't order appetizers. Now I know y'all hungry when you get there, but just be patient. The food's gonna come. All right? Take 3 bites of bread at the restaurant. Eat it slowly. Enjoy the bread, and then put it down. Right? You don't have to eat the whole loaf because it's sitting there. Now this was interesting. We should be drinking half of our weight in ounces of water. So let's say I weigh, 100 pounds. There you go. Actually, probably this thigh is that, but okay, theoretically, we'll make it easy. So obviously, half of that would be what? 50 ounces. So, you know, we used to hear the 8 glasses and all of that, but this is what science is saying. You need to be drinking that much water a day. And make it fun. If you sign up for Healthy Weed, you all got water bottles in your bag. Make it fun. Take your water with you. And do that for yourself. Don't talk and eat, because when we're talking, we're engaged in conversation, and we're just eating. Mouth is open, shovel in, right? And don't eat and watch TV. Now, I know that busted a whole lot of bubbles, because we're used to that. We do everything around TV. But once again, it becomes very mindless when you start eating when you're being entertained. So those were just some quick tips. You know, hopefully you'll get a lot of nuggets today, but that you can take out and start doing when you leave